But I want to take away the word patient, because I think we hide behind the fact we call people patients because it keeps us at distance from them. You know, doctors are great at this, aren't they? They talk about their patients. When they go home, they can forget about them, and they have to, put it in a little compartment, and that's the day gone. We need to focus on people, and we need to make sure that people understand exactly what we're trying to do for them. We need to educate them, but we need to look at everything through our patients, our people's eyes. And if we can do that, we will go to a different paradigm on customer level, and that's what today's about.
I was just really wondering about the view with the experts here today that maybe perhaps we could give you some tips.
Really? I don't think we'll be here that long, to be perfectly honest. I've got a referral on the printer. If you could fetch that for me, Paula.
Of course, I'll do it now.
Just to let you know, her pressures are sky high, which I'm a little bit worried about. And there's...
Is it necessary for the receptionist to know all the details?
Well, she'll only read the letter anyway.
They also wanted friendly service and to be more than a number.
I think myself, when you go to an independent shop, you get more personal service, don't you? You know what I mean? Than you do. They get to know you. Go there for a couple.
Well, I've been going to boats for years and years and years now, but I wouldn't know them.
No, they don't. That's what I say.
You know, different people, even the one the optician, or and all the others. The way
when you go again, it's a new one.
I don't know. They're all different every time I go.
That's what I say when I used to go to Frank's Lane. You knew who you were going to.
She knows you. She knows you. She knows your face when you walk in. You're just a number to them, I think.
Yeah, it is now. All these big places.
There's a recognition of how eye care can make a difference to quality of life.
And my granddad had 2 cataracts removed, and I saw how much his having the operation was done, how much it improved his vision, and how much more independent he became and stuff. But then I think from someone who doesn't really have any problems with their vision, they've never known any different, if that makes sense. They've always had good vision, and they hopefully always will have good vision. So for them, they value it.
So in some conclusions then, I think it's important to say, and I'm putting this in capital letters, most people are very happy about the service they receive. However, you won't be surprised to know, and you've heard people say it themselves, that optometrists get a lot of criticism for operating the business model. People within the NHS, ophthalmologists, all will criticise you, and you've heard this. But you play the rules of the game that have been set by others. You play the rules that are set by the Department of Health. You haven't set them. It's acknowledged that the cost of the eye examination, whether it be funded by GOS or people paying privately, is subsidised by the price of the frame. But vanity is an issue for many for not wanting glasses. Customer care and personal service is important. I'm sure that's where the independents can try and have their point of difference. But so are choice and value for money. I think this is important as well, given what I said about the fee issue. Many people feel rushed, and as a consequence have concerns about the face validity of the glasses that they have. And you heard that one woman saying with a lot of pathos and sadness in her voice about the fact she had wasted all this money. Price structure is confusing. And there are concerns about the hard sell. There's this feeling that if you go to an optometrist, your eye test might be free, but people aren't stupid. They know that it's free for the test, but then there's expensive glasses to come. And there's a fear of being pinned to the wall before they're allowed to leave the shop. So the mistrust of opticians and, of course, optometrists. And we, you, myself, others, need to find a way of making the high street experience a health experience once again. But hopefully I've given you some criticism, but again, the key message is that most people are happy about the service they receive. But I guess that's the theme for today, is how can we make that experience a better one, a more consistent one.
I have not sat on my glasses.
I'm not saying that you have.
Why are they crooked?
Well, it's just that we can have a little check to see if everything's aligned.
Stop.
Please, can we send this dear optometrist off to develop his language skills? I mean, he's umming and ahhing, and he's bumbling about in there, and he may be very good, but he's not really coming across to the patient really in a confident way. Can we do something with Martin, please?
My research has concentrated specifically on optics. So I've been looking at trying to understand the whole patient experience, experiencing visual symptoms, going to the practice, getting their eyes tested, understanding the decisions they make while they're in there. Why would they go for one lens over another? Why contact lenses, not glasses? Why that practice rather than that one? I look at communication within the practice, both between colleagues and with patients. So here's a suggestion of how you can actually put this into practice, how you can take something away and do something with this research in your practice. And it's the curvy approach. So this is what has come out of the research. People want to be confident, they want to feel they've been understood, they want to feel relaxed, they want you to reassure them, they want to feel valued, they want to feel that they're an individual. So what are you doing in each of these domains in your practice? What are you doing at the moment? Do your staff actually recognise the importance of all of these? Are you sure? Or do you just make that assumption? Because this research is coming from real people, so it's happening to them. What can you do to improve each of these areas? And I suggest you do this as a practice team, and you look at these different dimensions. So what you say to your customers, what's your interactions with them? What do you actually tell them? What do you do with each individual? What about your body language? Don't forget that either. What is that telling your patients? And then finally, take a fresh look at your practice environment. What message in each of these curvy domains is that giving your customers, your patients?
As one of the few patients in the room, I would be getting very uncomfortable at this point because I was feeling, increasingly. In my talk, I talked about being, trapped against the wall until I agreed to buy something, and having somebody coming in and invading my space and saying, "And this person's going to make sure that you don't leave the shop." I would find just way too much alcohol to be running at this point.
And I wouldn't actually I wouldn't bring the dispenser into my room. I don't like that. I'm only doing it because I'm scared of Sarah.
Robert, 1 second, Robert. Wait for a microphone.
Just a quick point. If you were having some nasty news broken to you, or you're having stuff explained to you by a consultant in a hospital, and they were to invite a very well-trained assistant or nurse or whatever in to help you get through the next stage of the process, wouldn't that be wonderful?
So I'm a coach, and I go around and I talk to people in different businesses and also in sport just about how they can help develop themselves, so creating the right environment. But first and foremost, for you guys in this audience, I'm a customer. Okay, so what you'll hear through this program is me as a customer, what I've experienced in terms of looking at the customers. What do customers need and what do they want? What do they have now versus what they could need in the future? And how do we know that? What's in our database in terms of the team? What resources or training might we need in terms of the soft skills? Because quite a lot of stuff is trained on hard skills, the hygiene factors. I know how to use this equipment, I know how to do this, I know how to use the diary. But how do I engage with different personality types? What does that look like? So start with a dialogue straight up. Keep us engaged, keep us informed. So if I don't see anything that I like and you don't pay me any attention, I don't hear anything because you're not talking to me, problem is, probably not going to spend any money with you. So finally, what lies beneath the surface? What sorts of questions can we ask our customers that's really going to engage them and want to come back repeatedly? What does our customer experience look like now? And what could it look like in the future? What does our map look like? What are the key areas that we might want to focus on and go back into the business? What can we let go of, take forward? Who can be involved? How can I involve the practice team? Because it is a team and we are a relay and we can't drop the customer. But more importantly, just like I'm sure you all joined Optics for the same sort of reason, can actually have some fun as well. we don't need to take ourselves so seriously. You can have some fun with your face. You know, put some daft specs on, put some crazy lenses in or something. Have a bit of fun.
So if you just like to step this way, Miss Winters. Paula, there's a referral letter on the printer. If you could get that ASAP.
Thank you.
Do I need to be worried about this? 'Cause
Not at all. Not at all. No, it's just a normal thing. I'm just going to nip into my...
You just seem to give some kind of secret sign.
No, itchy nose.
So, tip number 2. In your diary, make sure you write down things that you should be doing on a regular basis, like a practice inspection. Now, if I had my way, and we all had the time, which we don't, we should be doing this every day. But we should be doing it at least once a week. I mean, every time you walk through, you should be making a cursory glance saying, well, that's not right, we get that put up, we put that put right, we get this, we get done. But once a week, go through in great detail and look at it from a patient's eye view. There's such a thing called the crack pain syndrome. Somebody talked about this earlier, actually, but it's something that I know definitely a guy used to run a practice that... when I was a regional manager for Melson Wingate a long time ago. And I went in there and I said, you know the window, there's a crack in the pane of the window. And he said, is there? Oh, yeah. And he said, you know, I meant to have that done 6 weeks ago. Now, when the pane cracked, it really annoyed him. He was going to get it sorted out. He didn't, because he was busy. The next day, he thought, I must do something about that. The third day, he stopped seeing it. The fourth day, he hardly noticed it. The fifth day, he'd forgotten all about it. And he was genuinely, and I mean genuinely surprised when I pointed it out to him, even though he walked past it every day, and it's just because it became part of the landscape. So we must make sure we look at things on a regular day.
Next slide. And all together, super independent.